This video is going to be a simple quantitative approach to acid base, primarily using H plus ion concentration rather than talking about pH. When we talk about acid base, we are primarily focused on the H plus ion concentration. As mentioned in previous videos, it's H plus ions interactions with the amino acids that leads to the changes in the conformations of the different enzymes and proteins that affect our body. So we care about the H plus ion. This is a very simple formula to remember. H plus ion concentration in nanomoles per liter is 24 times PCO2 divided by bicarb. And H plus here is in nanomoles per minute. That's why it's 10 to the power of minus 9. Keep an eye out for the 10 to the power of minus 9 because that 9 becomes important in our math. And in this formula, your PCO2 is in millimeters of mercury and bicarbonate is in milliequivalents per liter. These are the commonly used units in the US. So this formula is very easy to remember in the US. And pH, as we know, is negative log of H plus ions. So let's do this for a normal patient. That means any of us. We should probably not call ourselves patients, but okay. We know the normal bicarb is 24, normal PCO2 is 40. So when we plug in the numbers, the 24 get cancelled and you have 40 nanomoles per liter or 40 times 10 to the power of minus 9 moles per liter. Because when we do the calculation of pH, we have to use this value. Simple formula. H plus is 24 times PCO2 divided by bicarb, whatever value you get. So it's a simple logarithm. pH is negative log of H plus ion, so plugged in 40 times 10 to the power of minus 9. In logarithm, when we expand, the multiplication becomes plus. So you have minus log 50 and minus log 10 to the power of minus 9. Sorry, log 40. Minus log 40 becomes 1.6. And negative log of 10 to the power of minus 9 is 9. It turns 9 minus 1.6, so you have pH of 7.4. So pH of 7.4 is the normal pH. Again, how do we make this process of calculating faster? So H plus is 24 times PCO2 by bicarb times 10 to the power of minus 9 moles per liter. So if we do calculation of pH using this formula, you know you're always going to have the 10 to the power of minus 9. So in a way, it becomes minus log 24 times PCO2 by bicarb plus minus log 10 to the power of minus 9. So it always becomes 9 minus log of the value you get when you plug in this number that you get here. Okay, let's do more math. Before we go further, let's remember Winter's formula. This is used only in metabolic acidosis, and this should tell us where the PCO2 should be if the patient is compensating normally. Let's look at different scenarios where either there is no compensation or there is the right amount of compensation, or if there is overcompensation, how much it affects the pH. So in a metabolic acidosis with a bicarbonate of 12, it can be ketoacidosis, lactic acidosis. Let's say there is no compensation. It is not uncommon for people to look at a PCO2 of 40 and think it is normal, which actually it's not, because it's supposed to be lower, because you're supposed to compensate. Let's say you do not compensate. So plug in these values, uh, you get a hydrogen ion concentration of 80 nanomoles. Going back just a couple of slides, if we plug those numbers in, it will become 9 minus log 80. Log 80 is 1.9. So it gives you a pH of 7.1, which is pretty low. A pH of 7.32. Let's see if there is the right amount of compensation. You have a bicarbonate of 12. Now we plug in our Winter's formula. Your PCO2 should be around 24, 1.5 times bicarb plus 8 plus or minus 2. This is not a difficult formula to remember. So once we plug in the PCO2 of 24 instead of the 40 in the previous situation, you get a H plus concentration of 48 nanomoles per liter, and plugging it into our formula, you do log 48, you get a pH value of 7.32. It's far better situation than a pH of 7.1, and this is what most of our patients should be doing, that is compensating adequately to a metabolic acidosis by blowing off more PCO2. Let's say a patient is overcompensating. In a subsequent video, we'll talk about different cases on scenarios where either you undercompensate or overcompensate to bring up the clinical relevance of all this. Let's say a patient's bicarbonate is 12, expected PCO2 is 24. For whatever reason, the patient is breathing much harder and gets down the PCO2 to 12, and you plug in the value of PCO2 of 12, and you get a H plus concentration of 24 nanomoles per liter. You can even be alkalotic despite having a metabolic acidosis, because the respiratory alkalosis normalizes or even makes the pH into the alkalotic territory. This is a mixed acid-base scenario. Your Winter's formula is key. And in a subsequent video, we'll also talk about how you can predict where your pH is going to be based on the changes you make to a ventilator, or in a acute metabolic acidosis based on the amount of bicarbonate you administer, where the pH would be. You really don't have to keep on doing gases. These are predictable. They don't have to be exact, but you'll be getting close to the predicted value. For those of you who haven't done logarithms in a while, simple to calculate using your iPhone calculator. Open your calculator app, turn it horizontal. So this is me doing the log 40. Type in your 40 and hit that log 10. That's how you get the values. So to just summarize, use the formula H plus is equal to 24 times PCO2 divided by bicarbonate, the units being PCO2 in millimeters of mercury and bicarbonate in milliequivalents per liter. Whatever value you get, do the logarithm of it and take it out of 9. That'll give you the pH and gives you a quantitative approach. What happens if the PCO2 goes up? What happens if the bicarbonate goes down? Where would the pH be? This becomes useful as you make changes to the ventilator in your alveolar minute ventilation, how it affects the pH. You can be more precise while you make changes to the ventilator, or if you're giving someone bicarbonate in acute metabolic acidosis, or if you want to go deeper, how you dose your CRRT as well.